Tonight, the CDC is encouraging all San Diegans to begin masking up indoors after the agency placed San Diego County in the high-risk category for COVID transmission. Good evening. I'm Kimberly Hunt.
And I'm Derek Stahl. Late this afternoon, the CDC moved the county into the highest tier because of the rising number of COVID hospitalizations here. Much of California is now in the orange with us, driven by the new Omicron subvariant BA.5. Tonight, we're going in depth on the latest research into what makes BA.5 so contagious, even among people who have been fully vaccinated. Hospitals in Los Angeles County have seen the number of COVID deaths double since last month, climbing from about 50 per week to about 100 deaths per week, the highest rate in months. In San Diego County, deaths have remained flat since February, but based on the number of hospital admissions we've seen, we might just be a few weeks behind LA, says UC San Diego's Dr. Robert Schooley.
As of earlier in June, we had a couple hundred people in San Diego's hospitals on any given day. We're now pushing up closer to 400 a day. I am worried that this increasing number of hospitalizations means that we're going to begin to see the death rate pick up before too much longer.
Most of the new cases in California and around the country are the new BA.5 subvariant, raising the question of whether it causes more severe disease. New studies show BA.5 has picked up some of the molecular tricks not seen since Delta. Japanese researchers found BA.5 can flourish in the lungs like Delta used to. And some new research out this week from scientists in Australia shows that once BA.5 enters a cell, it can churn out many more copies of itself.
It just makes a lot more virus. Some people believe that will cause more severe disease. Some people have anecdotally reported more painful sore throat, etc. with BA.5. But I'm reassured by data from other countries.
UC San Francisco's Dr. Peter Chin-Hong says countries like South Africa and the UK, where BA.5 hit sooner, did not see more hospitalizations or deaths than previous waves. And early research from the UK offers clues that vaccine protection against BA.5 likely remains comparable to what we've seen against Omicron.
You can have a really scary looking virus, but if you're really protected with boosting in particular these days, it doesn't matter how scary the virus is, your T cells and B cells that have memory are going to kick the virus out.
But BA.5 is arriving at a time when many people have waning immunity. 6 months after your booster with the Pfizer vaccine, scientists in the UK estimate the shots are 70% effective against hospitalizations from Omicron. Pretty good. But look at the protection against infection or symptoms. Between 0 and 10%. Both Dr. Chin-Hong and Dr. Schooley say it's time all adults got access to a second booster, not just people over 50.
I personally think it's time for that, and that government needs to move on and get that done. But it doesn't make sense to keep shuffling our feet and waiting to have a second booster available to the adult population.
Now, the CDC recommends indoor masking in public places and counties when they reach the high-risk tier. LA County officials say if they stay in the high-risk tier for 2 weeks, they're going to reimpose indoor mask mandates, potentially on July 29th. However, San Diego County Health Department has not been as direct as LA's, and they tell me that they will follow the guidance from the state, not the CDC.